Hi, we're going to do another injection demonstration in our video series of fillers and Botox injections. Today it's one of my favorite subjects. We have other patients online that you can visualize non-surgical rhinoplasty for. But today we have a nose that can definitely benefit from both surgical and non-surgical options. So I want to discuss that and go for both issues. This is often the case with most patients that are candidates for non-surgical rhinoplasty. They're also candidates for surgical rhinoplasty, but not vice versa all the time. 10 years ago, nobody was doing non-surgical rhinoplasties. It was unheard of. And most rhinoplasty specialists, like myself, were frowned upon it. We didn't want anything injected into the nose for the fear of scarring or infection. But over the last 5 to 6 to 7 years, we've noticed that if you choose the right substance, and by the right substance, typically it's Restylane, Juvederm, or Bellaterra, one of the hyaluronic acids, you can get a really nice result in a significant portion of patients, but not all patients. So you have to choose properly. I've seen too many patients go to an average dermatologist, get something injected into their nose, end up with a larger nose, but not necessarily an attractive nose. So the same rhinoplasty aesthetics, the same goals of a beautiful nose have to apply whether you're doing a surgical or non-surgical rhinoplasty. The reason I like the hyaluronic acid is that they're safer. One, they can be removed and dissolved if you want to, but they're also clear, soft gels. Some people come in asking for silicone, artifill, or more permanent fillers. That doesn't belong in the nose. Permanent fillers come with permanent problems. I've seen patients come in who've had permanent infections with permanent fillers into the face, and you have to cut it up like cancer or put them on high-dose antibiotics, put them into the hospital, give them intravenous antibiotics. If somebody has had an implant abroad, the implant can be easily removed. But a filler consists of thousands of particles and you can't easily remove it. So safety is first. If you're going to do something, definitely want to be safe. The other important aspects are what we talked about is the aesthetics of the nose. You can't just put a filler into the nose. You have to know what the radix height should be, what the tip projection, rotation. All these issues are important and you have to understand the aesthetics of the nose. Take a look at the patient, examine the patient, and then have a discussion, and I use computer imaging on almost most cases of non-surgical rhinoplasty, so they can see themselves what they can look like. Now, in this case, you have a beautiful young woman who has a small dorsal hump. The dorsal hump is luckily surrounded by an area that's depressed above it and depressed slightly below it. So in this situation, to get a straighter bridge, you can place a little bit of filler above it into the area of the bony dorsum or the radix, and a little bit of filler to the area of the supertip, giving it a straighter profile. It's important not to try to go for perfect straightness sometimes, because if you try to get it perfectly straight, it may be a little bit too high. So it's important to keep that in mind, and the goal is to reduce the appearance of the dorsal hump. Now, there are things that adding volume does. When you raise the bridge, a lot of times it makes the nose look nicer and narrower. Surgically, I could break the bones, do osteotomies, and make it narrow as well. Non-surgically, I can't do that, but by adding a little bit of filler to the bridge, you can give it the illusion of narrowness. Surgically, I can lift the tip up a little bit. I can narrow the nostrils a little bit. Non-surgically, can't do that significantly, but overall, you can still get a nice nose. It's important for it to be balanced to the face, age appropriate, sex appropriate, ethnicity appropriate, not to drastically change the nose. And I'm going to demonstrate that technique right now. So we have Restylane, again, a clear gel. The beauty of Restylane is its smoothness. It comes with a 29 gauge Terumo syringe. You want to make sure you have the bevel down. The tip should be down. We don't want to be inserting this under the skin. You want to be right on top of the bone or cartilage. And I'm going to demonstrate that. So I'm going to start up here. I'm going to grab the skin, elevate it. Gentle. Be gentle. There's no reason to be rough with the skin. I've seen some people believe that if you penetrate the skin quickly, there's less pain. That's just not true. And you can see it's little tiny droplets. These are not very large drops by any means. And then you mold and massage as you go. The nose is not as vascular as the eyelids and other areas, so bleeding and bruising is less common. But you still have to be aware of the surrounding. How are you doing? Okay?
Yes.
Not the worst thing in the world?
No.
Good. Come along nicely. And already if you look, if you kind of drop the camera angle down, just by injecting this area, you can see the bridge is smoother. And I'm going to continue a little bit. Again, micro droplet. How much of this have I used? Barely anything. It's just tiny, tiny, tiny little droplets. The other thing that's important is you have to be aware of brow tip aesthetic lines. If you draw a line from each eyebrow down towards the tip of the nose, each side, they have to be symmetric. Start narrow, progressively get wider. So there are certain areas that you don't want to widen or create asymmetry. Now we're going to go down here a little bit more sensitive here. One, because it's closer to the tip is more sensitive. Two, it's a new area that the lidocaine hasn't really kicked in yet. So I switch sides, and I'm always picking the skin up. You always want to pick up the skin as you inject. And it's tiny. I mean, my thumb is doing the job. If you have to keep looking at the syringe to see how much you're injecting, you're not doing it right. You have to trust your thumb and know how much filler each pressure of the thumb is depositing. And you can see it's beautifully starting to form. It's coming up nicely. You barely can see the bump anymore. I like to drop myself down to this level. Now it's just a gorgeous profile there. I'm going to go a little bit more. I like to overfill just a bit because what you see today is not what you end up with 5 days from now. There is swelling. The Restylane has other material in the syringe with it that goes away. So I don't want her to look at this 5 days from now and wish that she had more. So from experience, from years of doing this, I can predict with some good certainty where we're going to end up by next week, and that'll be the result she's going to get. Now, any type of bleeding, just hold a little pressure and it'll stop. Again, the nose, I've not seen any major bruises on the nose. It can happen. You still want to tell people, don't do this before a major event in their life. Give themselves a week or two, but 99% of the time, after a day goes by, it looks really good. Put on some makeup, get out there, and enjoy everything without really manipulating this. I don't want people going home massaging it. I don't want them going home putting any heavy ice packs on it. They can put some cold washcloths, but no heavy ice packs. If their glasses sit in such a way that it digs into it, I don't want them using it. But if it sits on the side and doesn't dig into the bridge, that's perfectly fine. They can wear glasses. I tell people not to exercise for just about a day or so. How you doing there still?
Good.
Good. It looks really good. And as the lidocaine is kicked in, it's probably a little bit more comfortable now than it was 2 or 3 minutes ago, correct?
Yeah.
Good. You can drop the camera angle and see it again right here. How beautiful that profile is. There is no bump left anymore. You can see how straight that bridge is. Now, I'm going to consider putting a little bit to the tip to just give that a lift. What do you think of that? You want to do a little bit to the tip? It's going to look good.
Sure, if it looks good.
Yeah, it will. So, the tip injection, it's very important to be conservative. Less is more. You don't want to put too much in the tip. But adding a little bit to the tip. Now I want you to show the camera angle again from the same side. And now you can see what happened to the tip. You got a little bit of a lift to the tip. Beautiful feminine dorsum. And the tip, you just got a little tiny raise and projection, which makes it look nicer. And from the base view, adding to the tip can even lift it up a little bit. So you get a little cuteness to the tip as you place it drop there. But don't put too much. You don't want to discolor the tip. You don't want to damage the tip. Well, it's a non-surgical rhinoplasty using Restylane. And again, it's not a lot of material. It's not a lot of volume. It's small, tiny micro droplets placed in the right places. I see tons of African American patients, Asian patients, Caucasian patients, and today actually, this is the third patient just this afternoon, and we do a lot of these injections. Do your research, watch the video, see the before and afters, and then I'd be happy to see you.